Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and I've got with us all the way from across the pond in sunny Ireland, Kieran McNally. Kieran, thank you so much for joining us today, man. How are you?
Hi, Scott. Yeah, I'm great. Thanks a million for having me here. I'm looking forward to it.
Yeah. Kieran, tell us a little bit about your academic journey and how it's led you to where you are today.
Okay, so I suppose I finished school when I was about 18, and I think you call it high school over here, so it's
Hmm.
secondary school over here. And I actually joined the army, and I spent 13 years in the military and went overseas, done two tours to Liberia and Kosovo. And then after my second trip, I decided to look at this something that I wanted to get out of the military. And so I decided to go back to college. And yeah, through the army, then I done a course called neuromuscular and physical therapy, which is 2 years certificate course. And it's just approaching, let's say, ailments and injuries from a very hands-on physical approach. And from there, then I joined up with my local semi-professional soccer club, and I started to treat people with, let's say, sporting related injuries, hamstring strains, ankle sprains, things like that. And as you know yourself, all of those types of injuries are going to heal themselves anyway. But because I was getting great results, I thought, geez, I'm doing very well for myself here. Um, that I thought, people are getting great results with me here. Maybe I should open up a private practice. So that's what I did part time. I'm still in the military at this point. And so a buddy of mine had a gym, so I rented some space off him. And from there, then I started to get people with all sorts of aches and pains and injuries. So from your regular sport related injuries to work related pains and even some persisting pain. And then suddenly I started to realize, I'm not getting the results that I was previously with all the sporting related injuries, because a lot of these types of ailments that I was getting weren't so much tissue related. But I didn't really understand that at the time. I was really focused on the physical aspect of injury or equals pain. So I really started to kind of look into this. I was like, well, why is this happening? Like, why am I not getting these results? I'm doing everything that I've studied in college. I'm following everything as per protocol, but I'm not getting the results at all. So a buddy of mine was going on to a course. I don't know if you're familiar with it. It's called Anatomy in Motion, which is Gary Ward's philosophy on human movement. And yeah, it was actually an excellent course. It definitely gave me better quality observation skills and learning how people move in three dimensions and being able to spot how, if somebody's not moving very well. It gave me great tools to bring into my practice and definitely helped with some rehabilitation side of things. And that did help within my clinic, but again, there were still people that were slipping through the net. There were still people that weren't getting better, and I was almost taking this to heart a little bit. I was like, maybe it's something that I'm doing wrong here. Like, it was like I'm following everything I'm supposed to do. What am I doing wrong? I'm always looking for problems, you know. So I continued on my journey. I've done various other courses, strength and conditioning courses, PDTR, neuromuscular, or sorry, neurokinetic therapy, just your regular dry needling courses and all that. And I applied all of these things. But people that were in pain for long periods weren't getting better. And it was only now that you mentioned we were talking off here about David Butler. It was only somebody gave me this book, Explain Pain by Lorimer Mosley and
Yeah.
David Butler, and I was like, oh my God, this has just answered so many questions for me. Like what, like why did we not cover this type of information on any of the courses that I had done? Like, I mean, I had been studying for nearly 5 years at that point, and I really didn't. Yes, we covered a little bit of the biopsychosocial model, but we didn't, we really, the approach was primarily just trying to view pain from a purely physical perspective. And all our assessments, all our like questionnaires and all that, it was all based around the physical aspect of pain. But this gave me a brand new set of eyes and definitely a brand new set of ears. So I started to listen more often. I started to ask better questions. I started to learn about the psychological influence of pain, the emotional aspect, like anything else that I could latch onto that I thought could influence pain, from sleep, lifestyle, like even alcohol, smoking, anything that what can influence pain. And then COVID happened anyway. And this was jumping on then to 2020, and I had to close down my business. Sorry, I should jump on that. I actually left the army in between all of that, and I opened up a full-time private practice. But then I had to close it down during COVID because we had lockdown over here in Ireland,
Yeah.
and I had to lock down for about 3 months. So day one of lockdown, I just said like I was going out my mind at home. So
Yeah.
I started just writing. Within 3 months, I had, I don't know, 30,000 words written. And then I just said, right, I'm just have something here. I'm just going to continue on with it. And I thought I'd have it done within a few months, but it actually took 4 years to write. But I published a book then in February this year. It's called Pain and the Survival Brain. And yeah, I'm happy to talk about this here today with you.
Yeah, man. First off, I love the title, right? Pain in the Survival Brain, because we've been really deep in diving deep into, the power of the brain lately, and metacognition and thinking, and all these things that we don't necessarily think about. But when we talk about physical therapy, there is a lot of therapy involved sometimes. I can't tell you how many sessions I've had with patients where, I just listened, right? I was a shoulder to cry on, or somebody to vent to, and it's like we
Mhm.
didn't do much exercise that day, but they got a ton out of it, and they felt better when they left. So,
Mhm.
it's interesting how powerful the brain is. So I love that you've incorporated that into the book. Tell us a little bit about your definition of pain.
Oh yeah. Well, I just think it's pain. Like when people are in pain, they're confused. Like a lot of people are suffering from chronic pain, especially. They don't understand why. Okay, the healthcare system over here anyway, and from my research anyway, it's pretty much the same in the Western world. We don't have much time to speak to our patients. On average, it's 14.1 minutes. Uh, to see a GP in Ireland. That's all the time you're allocated for 14.1 minutes. I think in the US it's actually a little bit more, maybe it's 15 minutes. And each person has 2.5 problems. So you can't really get to grips of, why somebody is suffering from pain within that time frame. So people are confused. They don't really understand why they're in pain. I try to keep things simple as much as I can. The whole book that I've written is broken pain down from a biological, psychological, social, lifestyle point of view into layman's terms. So to help people understand why they're in pain. And I just try to define pain as communication. That is it. That's all pain is to me. Pain is just one way your nervous system communicates to you to motivate behavior. And when you start to think of pain this way, it really it can take a little bit of the fear out of the equation because when people are in pain, they're thinking, I must have something physically wrong. My body must be breaking down. If they can't find it on a scan, then it must be really, really bad. Maybe it's something that they haven't checked here, haven't checked there. If you start to think of pain as just communication, and your nervous system is just trying to communicate to you, just like if you're hungry, just like if you're thirsty, if you're tired, your nervous system, your body is just trying to communicate to you to motivate behavior. If you think of pain this way, it reduces the fear, can reduces any anxiety. So really, that's what I like to help people understand is just pain is communication. I don't go any further than that.
Yeah, I love that definition, because if you think about it, like really getting good at your craft and your skill, especially in the world of healthcare, especially in physical therapy, being a good communicator is so imperative. The better you can communicate, whether it's your plan of care, whether it's the diagnosis, the prognosis, whatever it may be, the better you can communicate with your patient, the better practitioner you're going to be. So the
Hmm.
body's just trying to do the same thing and be that communicator, the brain's saying,
Yeah.
"Hey, here's a signal, just throwing this out there, but something's going on. You may want to take a look at it, address it.
Hmm.
Something's up, right?"
Hmm.
It's not dangerous. It's not something to be scared of per se. It's just a signal, right? A check engine light, so to speak, Um, so I love the book here. I think there's a lot of really good topics in it, and I love the fact that it is in layman's terms. That's super important. I think Adrian Lowe's book, Why Do I Hurt, was one of the first ones I ever read that was like really for the patient, where I was like, oh, I can understand this. I was an
Yeah.
English major before as a PT, so I needed that in
Okay.
layman's terms. It was hard, especially neuro. I struggled in neuro, so that was hard for me. But I had to get it in layman's terms. And I love the fact that, I could give this to my mom and she would understand it. She'd be like,
Mm.
oh, okay, yeah, I get this. What is that like that line or maybe, that border or boundary of like where we get a little too technical and termy, versus like being able to describe it in layman's terms, like, we go back to the communication point, like how
Mm.
important is that in the world of pain?
Yeah, well, I suppose it depends on obviously the patient as well. And I suppose this comes with experience from me that sometimes you can explain things on a deeper level to certain people. But let's say if somebody that you could say would score high on neuroticism, somebody would maybe uh, score high with negative emotion. There's certain types of information that you want to disclose. There's certain type, not disclose, but maybe go in depth on. But there's other things that you just want to keep it as as
Yeah.
simple as possible for them. So I really try to personalize it for people themselves, for each individual that comes in. And some people are really curious and would really like to know. So it really depends on the person that comes into me, really. But I think in general, there's so much information out there, and that if you are a doctor or if you're a GP or if you're giving a diagnosis and you're not spending the time to explain to that person what that problem is, or not just something simple as like this is a bulging disc, this is what we found on your MRI, that person then is going to want, like human beings need to find the meaning in things. We're not just going to find just accept the information because you've just said what it is. The majority of us will want to know what that means. So if you're the physician or the physio are not explaining what you're saying, that person then is going to try and find it from somewhere. And generally, they'll find it on the internet. And you know yourself, then what we're going to do is on the internet, you're going to find worst case scenarios, and that can cause all sorts of problems. And again, it comes back to the personality side of things, that if you are a neurotic person, you will search and search and search and search and search, and it just can spiral you out of control. And then that's going to affect your behavior. It's going to affect your fear, worry. And then, for something as simple as this is what this diagnosis means. This is our plan. And spend that extra couple of minutes. You can go into some technical terminology if you want, but explain what it means. And also give encouragement and just not leave that person leaving your clinic or leaving your wherever you're treating them uh, with questions.
Yeah, I mean, one of the things that I think we see, like, I love the personalization factor, right? That has to be a part of every plan of care, right? So, like, meeting the patient where they're at, knowing a little bit more about, what may help them, what may, not be so helpful. There's a article written years ago called "Words That Harm, Words That Heal" in one of the PT journals, and a lot of language, especially that doctors use, can be pretty damaging psychologically, right? So we got to try to unlearn some of that stuff and like re-educate sometimes.
Mhm.
What one of the things I do see though a lot of times is when people get this eye-opening moment of like, oh my goodness, pain. I didn't
Mhm.
even think about how this is working and the brain body
Mm.
connection and all this stuff. And they go hard into pain science, and that's the
Mhm.
only thing. And they're just
Mhm.
educating about pain.
Mhm.
That's going to fix everybody. What
Mhm.
is your approach to that? How do you try to stay grounded in all the other stuff that's
Yeah.
going on too?
Yeah, such a good question because I did fall into that trap at the beginning. And I think there was a bit of a revolution around that time, let's say 10 years ago, where everybody was using pain science as a
Hmm.
treatment. Um, and I suppose for me, I just refined it. I just saw what works. And again, it gets to the point, if you can get your message across while you're doing your exercise, while you're doing your movements, you could be standing there. I get at a point there, I'm nearly standing across from my uh, client that's in with me, and we're just having a normal chat. And I'm listening to what they're saying, and I give them certain exercise or movements to do. And it can be in between each set. Okay, well, why did you do that this way? Okay, why did you hold your breath doing that? Why did you put your hand out to put yourself on the ground? Just again, you're observing how they're moving, and if there's anything you need to dissect from, well, I was told not to bend over, that bending is bad for your back, then you can explore that with them. So you can unravel a lot of the the areas from the, let's say, pain science point of view by just in between like exercise and movements or rehab, or even if you are doing some work on the bed, which I probably don't do as much as I did do in the past, but they're the times to have those conversations rather than spending half an hour standing in front of a whiteboard writing down, here, this is the biopsychosocial model, this is how, nociceptors send information up to the brain, and yada, yada, yada. So really, I suppose for me, it was, first of all, learning the information, okay, learning it on a deep level, so then I could communicate this better to my clients in a more efficient way, like depending on how the session is going. So it's nearly like you're just dropping in little nuggets every so often, and then listening to the language, looking at the behavior, looking at how they are moving, and asking the question, why? Why did you do it that way? Why did you say it like that? Listen to what they're saying. Is there any fear? Is there any worry? Is there like coming out in the language that they're using, and dissect that question and say, why did you say it like this? Who told you this? And then dissecting it from there. That's how I like to go about things.
Yeah, I love that. It's I know a lot of people don't like that cliche phrase, a tool in the tool belt, but really
Mm,
using it as an application or a tool while you're
yeah.
doing your whole big plan is a great way to keep interjecting it, right? And to take it even a step further, you said the way they say things and how they react. I'm even going to take it a step further and say some of the nonverbal stuff, the
Mm,
wincing,
mm,
the avoiding certain movements
yeah.
or going into a direction, pointing directly to where it hurts, or
Mm,
grabbing and rubbing a whole
mm,
area. Things like
yeah.
that can inform us on
Hmm.
what's going on. So that's great information and feedback to get as well. So if you're just kind of being observant
Mm,
while you educate, you can
yeah.
interject those things very masterfully, and it's not easy. I mean, it doesn't happen
No,
overnight.
no,
Uh,
it definitely doesn't. But
yeah,
like you're absolutely on the money there. And sometimes patients don't even realize they're doing it. So it's not as if, so like let's say you're giving them an exercise and just say on camera where they might be doing that after the exercise with their hand down by their side. They're so used to doing that, they're not doing it consciously. So you have to make sure that you're tuned in to, exactly what their body language is doing. And you might ask that question, why did you do that with your hand? Oh, I have a bit of tingling in my hand. And they might not have said that because they're so used to having the tingling
yeah,
in their hand. So again, to me, it comes with experience. A lot of that type of stuff comes with experience, really. And that's how I got better at that myself. But you
yeah.
have to be willing. You have to be willing to get better. There's a lot of people out there in my industry that I feel that they think they know it all, and they think, oh no, this is, as good as it gets, and that's how they work. They're not looking to get better. For me, I always want to get better, not just in this, in every aspect of my life. And I'm glad I am this way.
Yeah. Yeah, we talk about the Dunning-Kruger effect a lot on the show. Like you think you know everything, you get out there and
Mm,
then you realize, oh, I
yeah,
don't know anything. And it starts
yeah,
from the bottom
yeah.
again. You got to slowly work your way back up
Work
that
your way
journey,
back up. Yeah.
Yeah. So I love the fact that you've got this like tying it all together chapter at the end, because I'm a big fan of like Cliff's Notes, TLDR,
Mm,
right? Too long didn't read. Like I love when I can, summarize something, and you've done
mm,
that really well. Tell us a little bit about that kind of big picture overall message you want to give to people, especially practitioners, maybe
mhm,
students or new grads who are just getting started and just discovering this world of pain science. What's kind of like a
mm.
takeaway you want them to know?
Well, look, don't first of all, don't put too much pressure on yourself to know all the information straight away. Like everybody wants to know it now. They're impatient, and especially the world we're living in now, it's TikTok and it's all consuming
Mhm.
information straight away. And people just want to be influencers and have all that information straight away. So for I suppose the student, just take your time, really, learn your trade and, not to put too much pressure on yourself straight away because like even I'm, on the go of, let's say, 12, 13 years now. And, I still, feel like I have a lot to learn.
Yeah.
Um, but from, let's say, from somebody that is suffering from pain, really, I just want them to, the whole part of the book, the start of the book is for help to help them understand how pain works, and then all the areas of your life that can influence it. And also, I want them to take control of their own life. So this is the issue is that we are too reliant on the health world, really. So we're putting all our eggs in, like, oh well, maybe I can get a tablet for this, or maybe they can give me an injection for this. This book is for helping you to dissect all the areas that can influence pain in your life. Okay, this is you can dissect your life. Okay, and then you could have a twin brother, or you could have, a parent, somebody that's close to you that might live a similar life as you, but their pain, if they're in pain, their pain will be different. So they can use this book to dissect their life. And this is the thing about it. It's about understanding pain as a whole, then all the areas from a biological, psychological, social, lifestyle point of view, and being able to apply it to themselves, and then having an action plan at the end to make changes to these areas. I'm sure you've seen the analogy of the glass of water. I think it's used across many therapies that everybody has a glass of water, and within your glass of water you have different pebbles, and each pebble is a stressor in your life. And the more pebbles that you have, and a pebble can be like sleep issues, movement problems, injuries, it can be stress levels, work related problems, all of these different stressors on the system, they all rise up the water level. And then at some point, the water overflows, and that's when we experience pain, or that's when you damage tissue. So for me, I want to help them in two ways: to either make that glass bigger by building resilience, by building strength, confidence, education, and then also other ways of taking the stones out of the glass or making the stones smaller by understanding what areas of their life can influence pain and can you make changes to those. And as a result, bring the water level back down. So you have a bigger cup and now you have lower water level. So all in all, then that can reduce pain. So really, that's what I want for the individual that is suffering from pain as well.
Yeah, such a great takeaway. And like I said, as an English major, analogy approved,
Mhm.
I love the use of story and analogy because it does. It shows people the bigger picture and they can understand it, and that kind of stuff sticks, right? They get it and it stays with them.
Mhm.
The knowledge is literally transferred so that they can then take the responsibility and the next step
Absolutely.
and
Yeah.
implement, right? Because
Mhm.
I could give them all the information in the world, but if they're not doing anything with it, it's useless. So they got to
Yeah.
understand it, then they got to take action on it, and that's
That's the
your,
thing as well. And even what I've tried to help myself, I suppose more in recent years, is work on ways of motivation. How can I
yeah,
motivate my clients a little bit more? And one of the first things I say is that, like, you have to make changes. Like, what has got you here won't get you there. So if you have to make changes, and I don't have a magic wand, and if you're not ready to make those changes, well, then, there's only so far you can go. And so the onus, and again, it comes back to me as well, as that the pressure isn't on me like it was when I was just doing rubs and massages and things like that, and people weren't getting better. I was taking the pressure, I was taking it to heart. Now I can take some responsibility, but they have to take responsibility as
yeah.
well, and that's something that they need to understand too.
Yeah. Yeah, I had to learn that the hard way too, was
Mhm.
disconnecting the outcomes from myself and my
Yeah.
identity and my personal being. Because I worked at a workman's comp company where it was a lot of like low back strains from the FedEx guy who lifted a box wrong. I saw it all day, every day. Got really good at low back treatment.
Hmm.
But there were a couple people I just couldn't get better. And I was throwing the kitchen sink at him and nothing was
Yeah.
helping. And then the doc finally talked to me and said, "Hey, it doesn't make sense for them to go back. They want to stay home. They're collecting a paycheck on the couch. So
Mhm.
no matter what you do, they could be malingerers." And I was like,
Yeah.
oh,
Mhm.
duh. Like the light
Yeah.
bulb went off. And I was like, oh, as long as I'm given the best possible plan of care and
Mhm.
treatment that I possibly can, I'm
Mhm.
good with it. I've done all I can. Not everybody's going to get better, right? And
Mhm.
and you don't have to know all the answers. All you can
No.
do is the best you can with the knowledge you have and the research that's out there and
Mhm.
hope that it works. And if it doesn't, let's find someone else maybe that can help you and refer you on to some other option because what we're doing isn't working. And a lot of times I find that the people that truly are in pain are not getting better. If you're open and honest with them and you give them all you got and you show that you care, they'll come back
Mhm.
to you anyway.
Yeah, absolutely.
Like, hey, yeah, we didn't get results, but like, I really like the way you work. I like that you listened to me and that I felt heard. And, I
Mhm.
really like the treatments. And so, it was the best approach, best plan of attack for me. So,
Yeah.
well, Kieran, thank you so much, man, for coming on and just sharing your international viewpoint on pain. I love when we
Mhm.
can get different perspectives on
Yeah.
this. We ask all of our guests this one final question, and that question is if you could change one aspect of higher education, whether it be physiotherapy or otherwise, what aspect would you change and how would you change it?
Oh, for me, definitely, it's better communication skills. Like, I just think that that is just so overlooked I think that for me, once I started to learn how to communicate better with my clients, that really just the results that I got just dramatically changed, learning to listen and being able to validate somebody's experience and not tell them, no, that's not why you're in pain. Because straight away, if that person believes this to be true and it's a core belief of theirs, like they'll shut that off, because like who am I? I only know them for 5 minutes and I'm telling them that they're wrong, that their experiences aren't real and their experience of pain isn't valid. So for me, learning the communication skills, the stuff that we talked about there, the nonverbals as well, spending more time doing that type of I suppose maybe modules in something like that in university. I think that would be one of the greater changes that are made.
Yeah, you didn't know you were going to physio school to become a public speaker and master
Yeah,
communicator, right? It just kind of becomes part of the job. You have to kind of
yeah,
learn it as you go and get the reps, get under the bar and do the reps. Well, Kieran,
yeah.
again, thank you so much, man, for taking time. Where can people find the book? Where can they reach out to you if they have follow-up questions?
Yeah, so you can get the book on Amazon. It's Pain and the Survival Brain. You can get it on Amazon. You're better off not buying it through my website in Ireland, or the shipping fee would be too much, I'd say, to America. But yeah, if you have any follow-up questions, you can get me on my website, which is kieranmcnally.net, or my email is info@kieranmcnally.net.
Awesome. We'll put all those links in the show notes so everybody can find you easily.
Mm.
Kieran, been an absolute pleasure, man. I appreciate it.
Thanks a million, Scott. Cheers.